We're here to talk about the benefits of laser therapy, and we were joking earlier. At least I don't know if we were on air or not, but we were talking about lasers, and of course, when most people think of lasers, I watched The Big Bang Theory and stuff, and the lasers cutting through metal and shooting
Right.
into the stars. But this is cold laser, and there's a lot of benefits, and I actually
Check 1, 2, 3, 4,
wrote
5.
up some things. But
Talking right now.
is that going on the air?
Okay, you guys can hear me then.
Absolutely.
I still cannot hear you.
Okay, but we had the best conversation ever too. Are we not on air?
You're good.
So we're still going. I'm having a good time. A brace for impact. Brace for impact, people. We're going.
Mike's doing a great job
He
here.
really is.
I'd be throwing things by
I'm
now.
impressed. I am, but that button does get pushed though with Duck.
Okay,
it
it
takes
does?
a lot to push his button.
Okay, I thought it was because he's a golf professional.
He is a professional in all in all ways. Cold lasers, and
Yes.
as a matter of fact, I had the pleasure of visiting your establishment when I'm freshly out of surgery, and we're talking about maybe how I can get healthier, which is one of my goals. And everybody's got an opinion on how I can get healthier. It's funny how everybody worries about me, but I am now serious about my own health. But you're about to do a laser treatment on me, and I ran out the door because I didn't want my foot cut off. But then I finally realized there's benefits. Can you explain what a cold laser is? And as a matter of fact, what I found more interesting, I'm going to speed this up, was that Albert Einstein convinced the theory of light and amplification through stimulated emissions of radiation, which is the laser. Like, did you know what laser stands for?
I don't have it memorized.
I don't know what
It's
stands
light amplification through stimulated emission of radiation,
you
or
go.
laser.
Wow.
That was Einstein,
cool.
1916. See, I do my homework, man. I do. But there's benefits to the human body.
Absolutely.
And I know there's laser they do lasers in the eye, but I bet that's not a cold laser.
No, that is not cold.
That's a hot laser.
Yeah.
So that's when they're zipping your retinas or whatever you're doing. So tell me about this cold laser and how you got involved and some of the benefits. And
Yeah, I'll tell you how I got involved. I really wasn't into the lasers at first. Being an athlete myself, I was having a lot of issues with my knee, and I had been dealing with that for like over 6 months and couldn't figure out what it was. I had seen other specialists, and I was at a conference, and this gentleman actually picked up the dinner of all of us that were sitting at the table, and he said, "All I ask is that you," it was a California Chiropractic Association conference. He said, "Just stop by my booth." So I stopped by the booth just as a courtesy, and he asked if I had any issues. I said, laser's my knee. I didn't notice any difference, and I thought, okay.
Did you smell any burning skin?
No, nothing was burning.
Okay.
And then the next day, I had the issue was mostly walking downhill. I was going down steps, and the pain was gone, and I haven't had any problems since. So it piqued my curiosity because they're not cheap. A lot of people do think that they are, like lightsabers, and,
Yeah, I know.
and like how, what do lasers do? So that's how I got into it. Really great benefits.
So you were
with it.
treated before you learned about it.
Yes.
So that's which is interesting.
Yeah.
But obviously you piqued your interest, so you studied it.
Right.
It stimulates all cell types.
Yes. So what they found is that at 630 nanometers, that's the same frequency as our cells in
Is
our
that a
body.
class 4? No, that's a class 3.
Yes. It stimulates the cells in our body. So the laser stimulates the body to produce more ATP, which is energy, and glutathione, which is an anti-inflammatory.
Wow.
So what I usually tell people is that the laser helps cellular communication and decrease inflammation.
Yeah, so it's healing right in the deep tissue, is that right or no?
Yeah, no, so it's really interesting. So I brought 3 lasers in today. One laser is designed for like when I'm working with traumatic brain injury, like concussion. I can use it on the brain.
Wow.
Another laser I can use for more superficial things. So maybe like just like low back pain, typical things like that. And then I have another laser that allows me to go even deeper. And then we might be getting into the deeper muscles of the back, plantar fasciitis, golfer's elbow. There's just what you can use the lasers for.
Fibromyalgia,
Myalgia, yeah. Yeah, exactly. Like I've had
tendinitis.
all those things, all like chronic pain, inflammation, brain injuries. I have foot neuropathies. We have people who have neuropathies like diabetic neuropathies. I was thinking of some of the cases I had. That the coolest cases. One of them was this lady had her toes were turning purple because of lack of circulation, and she had a lot of pain. She had neuropathy,
Yeah.
and actually there was almost black, and that came back to normal. I know
From laser treatment. So I heard you mention, and I'm going to talk. I was trying to impress you with my medical words.
You
in
were
my
doing a
paper
great
here.
job.
But it takes down inflammation.
Yes.
That's the main.
Yeah, that's
it
the- I mean-
stimulates and takes down swelling.
Yes.
So it lets it get more oxygen, more blood.
Yeah.
Into the area,
and
into the cells.
promotes healing. Yes.
Which is huge, right?
Right.
I mean, this is huge because if she could have lost her feet, her toes.
Yeah. I mean, that was one of the things. You know, like a guy last year came in with a meniscal tear in his knee, and we that worked out. He was feeling a lot better. Now he's playing baseball again. I mean, you can pretty much use it on anything. It's not a cure-all, but
So this might sound like a weird question, and I don't mean it to be, but do you just use it up for anything anyways? I mean, people come in.
Yeah. Well, so
We're going to laser you. I asked if you played tag around the office. I think that was kind of fun.
Yeah. No, it is. That's a great point. So I had a runner come in the other day and having a hip issue. So what I did is I tested something called myotomes to see what nerves, if any of the nerves were being affected. They were. So I used.
Was that the tuning fork
yes,
thing?
So
I love that.
So I used the laser to upregulate, start stimulating those nerves, and then I took the other laser and went right over the area that was inflamed to help decrease inflation. So
Is
the
it
person
immediate fix, or is it something? It's prolonged treatment until. Is it? How do I say? Does the reversal of the problem happen immediately?
So the gentleman I mentioned that had the meniscus tear, he got off the table. He's like, "It's better," and and in my head, I was like, "No, it's not." You know, okay, sure, right? And he's like, "No, it feels a lot better."
Really?
Typically, what I tell people, depending on what their issue is usually one treatment for every 10 years of age. And then what we do is so then we also look at if you're not responding within 3 visits, it's probably not going to work. So you have.
So if you're over 30, forget it.
Well, if you're only 30, you
because
don't.
I would need 6 treatments.
Yeah.
Well, I'm 58. I mean, 5.8 treatments.
Basically, you look at that, and that's almost for anything, which is really interesting.
And why they? I know I love that analogy. But would you treat a 10-year-old?
We like this laser we used on ear infections.
It looks a lot like a taser.
Yes, it does, right?
It's cool looking, but it looks a lot like a taser.
Yeah, so that like we can.
Not that I know what it is.
So you're asking like. Ear infections.
Yeah,
you can.
So you
put
do.
on the outside. Cold.
So why would I need 5.8 treatments because of age?
It's just what I found. Just clinically, that's what I've come up with. That's not. There's no. I mean, some people have needed more. Some people have needed less. But that's kind of where the ballpark. What I've found for most people, it seems to be that falls into that range. I'm just wondering
if it has to do with the age of the cells, or whatever.
I mean, it could be, right? I mean, younger people definitely respond better.
I'm very intrigued by this bullet. This bullet says carpal tunnel syndrome. My wife had surgery on both of her wrists.
Yeah. And
suffered bad from that. And I know some people that it seems like the symptoms are carpal tunnel. They haven't been officially diagnosed, myself included. Remember, I had the nerve pain in my hands and feet, much better. But does it really help carpal tunnel?
Yes.
Really?
Yes. Yes.
Wow, man. If you're listening right now, because golfers, when you get carpal tunnel syndrome and you're a golfer, it is a struggle. Man.
Oh, it's
man.
I haven't had it. I had the sciatica in my knee, and Dr. Ryan used it on my knee and along the leg area. It's awesome.
Can you do it from 2 miles away?
No. No.
Can you do it through walls?
2 miles away.
I mean, you shoot a laser, I'd bounce it off the moon.
Right?
Yeah, that's true. That's a good point.
One of the things that's neat about this particular laser, the lasers have this laser has the ability to identify the areas that are inflamed.
No kidding.
You can run it over the tissue and it'll beep, and that's always fun to see the patients that come in and you're running that, and they're like, you just run it, and they're like, and it starts beeping. They're like, well, that's exactly where it hurts.
We gotta try that. Like, see, seriously, I want to try it like on my shoulder. Remember, it was a couple weeks ago I saw you. I mean, the shoulder's getting better.
It has sensors in there that can identify where your issue is.
Yeah, well where inflammation is, not your issue, Billy.
You turn that thing on me and it explodes. Because I am one giant inflammation, basically.
One giant inflammation.
Do you have giant size? Do they come in size?
Oh, that's funny.
Well, so that's a good question. So this laser, why I can use this for the brain and everything, it's only 5 watts. This laser right here is a 25 milliwatt laser, and then this one is a 50-watt laser. So they're different strengths too.
So this is less milliwatt. That's 1,000 watts?
This is
25,000 watts?
Yeah.
Wow, that's for you, Mike.
I know,
it's 25
huge.
watts, not
20. You said milliwatts. I thought you said 25 milliwatts.
I meant watts.
Oh, watts. That's
Sorry,
25
yeah.
watts. Okay.
Sorry.
So, wow. So you, so what's the downside?
Well, I think the downside is if you run it too long. What they're saying, there is no downside, but what I've found and I've heard from other colleagues, if you run it too long, sometimes people say they got foggy thinking or they just don't feel right. And I think it what we call exceeds the metabolic capacity. It exceeds the body's ability to utilize the energy, but it takes 90 minutes to absorb all the laser light, and we find about 72 hours you get that benefit. The cells get that benefit. And so what the research is showing that is you don't want to keep the laser in one spot longer than 10 minutes. So we are always moving the laser. And what's nice about two of these lasers is it's super pulsed. So not only does it not heat up the tissue, but it doesn't allow the tissue to adapt to what you're doing. So you can actually leave it there a little bit longer, but I still don't exceed the 10 minutes based on what the research is showing.
Is that the subcutaneous tissue we're talking about?
Yes, Billy.
Wow, look at you. I'm sorry, I've been outside of the realm of this conversation.
So, and I bet you
I'm just
didn't know
kind of diving
the
in
lasers
there.
can penetrate 2 to 5 centimeters below the skin. It goes through all the skin layers, man. And of course, as you know, Mike, the epidermis, you would know it does that.
The
of course.
epidermis.
And the dermis.
Did you know that's the largest organ we have is the epidermis?
Well, it's the largest organ you have. So, there basically is no downside.
That's what the research is showing. I mean, like, you wouldn't want to laser over a cancer or anything like that. You know, if there was a knee problem and there's bone cancer, that you wouldn't want to laser over that. There is some negative side effects that way. But considering the person's got healthy tissue, it's inflamed. There are no.
What percentage of your patients? Well, obviously that's probably a wrong question because everybody's different. But are you using these things a lot?
I am. I am. It's just as my practice evolved and how I practice now. You know, I used to just put the laser like on the area of involvement. Like if they had knee pain, I would put on there. But now because of the
Did you bring your power source for these things?
I did,
Good.
actually.
So when we come back from break, can we zap Mike?
Nice.
Yes,
yeah,
we
that
could.
would be cool.
I want
to be
Can
zapped.
you see the light? I mean, you have to, so you know where you are.
Yeah, you can see it.
I want to zap him.
Okay, I'll let you do that. I mean, he just has to wear protective eyewear.
Well, I won't get his eyes.
Okay.
Don't all you guys have to?
Well.
Okay. Don't you guys all have to wear a protective
We're
eyewear?
not welding here, man. We're going in.
We should.
All right, we got to take a break. We want to thank our partners on the show here, Dr. Ryan McGaughey in the studio, McGaughey Health Group, HealthySlowCounty.com, and Dr. Ryan also sponsors our PGA Tour Fantasy through Fantasy Golf with Golf Talk Radio with Mike and Billy. Visit golftalkradio.com to see all our partners and sponsors, and we'll be right back. I'm going to get zapped.
Yeah, and you know what's cool? Arthritis pain, and we'll come back. I want to talk about that because a lot of us suffer from that, and golfers go just crazy with that. So this could be a huge benefit.
Absolutely.
Okay, cool. We'll be right back,
Take us
guys.
out, Mike.
Golf Talk Radio with Mike and Billy right here on the Golf Talk Radio Network. We'll be right back.